This is Chapter 9, Module 9, Taking Vital Signs. And in your book, it starts on page 79. So again, you need to know words. When you're done watching this video, go back and see if you remember what they are. Our objectives for vital signs. So vital signs are taking pulse, blood pressure, temperature, and respirations. And for home care, if you're working for a home care agency and you're working non-medical, so you should not be expected to take a blood pressure. However, the expectation is that you can take a temperature and you should be able to take a pulse and respiration and use the automated blood pressure cuffs. Um, so with those, we're going to go over the vital signs, the 5 locations for taking temperatures, how to use different thermometers, where to take pulses, a heart rate, how to count respirations, we're going to look at the different blood pressure devices that are available and recognize what vital sign measurements you need to report. And with that being said, you could always Google it on your phone. So that's a good thing. You could always call the agency if there's any doubt. We can't memorize everything. You're not doing it all the time. Okay, so understanding vital signs. Um, so vital signs, first of all, the word vital means very important, right? If it's vital to his vital to living, it's important. If it's vital that you get to work on time, it's important. So vital signs are important measurements of body functions. And again, it's taking a temperature, how hot someone is, taking their pulse, and it counts the heart rate, taking respirations, that's our breathing rate, and then a blood pressure. And we also, there is a fifth vital sign, and it's pain. We don't always measure that, but it is considered the fifth vital sign. And pain's is not visible. Like we could say someone looks like they're in pain, but we don't really know how much pain. So they will report the pain to us, and everywhere uses a scale of 0 to 10. 0 is no pain, 10 is the worst pain a person can imagine, and they rate their own pain. So so the beauty of that is if someone's rating their pain a 5 and then it goes up to 8, we still don't know how they feel, but we know it is increased. And the same thing if they start out at 5 and now it's a 1, they feel better. And we'll learn how to document what to report. Okay, but first we're going to do the main vital signs, right? So blood pressure, pulse, and respirations. And there's one thing that we often don't um, it, talk about, but it's that it has to be accurate. And I have seen this a lot, and people aren't sure what they're hearing or feeling, and then they report it anyway. It's better to just say, I'm not sure. I felt like I got a pulse of 110, but I'm not sure. So at least the person you're reporting to knows because they're going to make judgment calls on what to do. Okay, so that's why we have it in big print. Be honest if you're not sure of the measurement. You will be respected for that. Okay, and then we're always going to check the plan of care. Are you supposed to do this or are you not? What to report, um, and we'll follow the guidelines given. Okay, measuring body temperature. This is the first vital sign we'll go over. Um, and either too high or too low a temperature can indicate serious health problems. With infection, it's usually too high. With hypothermia, where someone was out in the snow or out in the ocean here, they could have hypothermia where their body temperature is too low. So 98.6 is considered the average temperature, but average doesn't work for everyone. Some people could be a degree or two within and still within normal range. So I've seen older people with it 90, 95.8 and they're fine, because older people are likely to have a lower than average temperature due to the aging process and decreased physical activity. However, if someone's out in the sun and they're doing things, they could be, 99.8 and they have no fever. They're just hot because they're running around in the sun. Okay, as we know, we're using a lot of thermometers that are non-contact that you just put across the forehead. So just watch, because the older ones, you had to touch the forehead. So that could get confusing. Okay, and we could also take temperatures um, rectally, although we hardly ever do that. But that is the most reliable, most accurate. If you ever have to do a rectal, and usually we used to do that more with children, but now they have better, you know, ones that you don't have to touch. However, they're not as accurate. Make sure you always hold that thermometer in place. If we're still taking an oral temperature in the mouth, um, you have to make sure, so that's the person's bottom jaw right here, that you put it back way in the back to touch these heat pockets. Otherwise, here's the base of my mouth. I need to get it in way there and have them close their mouth. Least accurate is this axillary measurement. So you're putting a thermometer under someone's arm and you really have to push it up there so it has good skin contact. Okay, oral temperatures are still one of the most common, but we can't do those on everyone. The person has to be able to put that thermometer and hold it under their tongue for a while. So for accurate reading, the person must be able to breathe through their nose. So who can we not do it on? We never take a temperature on someone who's unconscious. We shouldn't take it on people who are on oxygen. They're getting oxygen by mouth or nose. If they're confused, because they might bite down on it. If they're disoriented, because they could bite down on it. Or if they are coughing a lot or vomiting a lot, it's not going to be accurate, or they can't keep their mouth closed and breathe through their nose. Um, Anyone who has a history of seizures, we shouldn't do it on, and then children less than 5, we should not do it on. Okay, so I just wanted to show you, this is big picture, but these thermometers, they come with these probe covers that you could put on. And they're little plastic covers. Let me see if I get a better picture of that. So they're little pieces of plastic that you put on there. And so if you're working in a facility and you're using a thermometer that's used for different people, they all have some kind of covers, right? This is an oral thermometer. The ear thermometers have covers, so they're disposable. You throw it away um, when you're done. So I'm telling you that because sometimes people don't use them because they're not aware of that. So that's probably the most important thing. Okay, and the last way was with an ear thermometer. So this little portion goes in the ear, and I know you can barely see it, but there's a plastic cover that could go on this mechanism, and then you don't even touch it to take it off because they all have a little push button, and you just push button and push it in, and then it could go right into the garbage. Um, so when we're taking temperatures, um, we're going to make sure that if you're taking an oral temperature, they could have it that way, or they could do it under the arm. To always tell the resident what you're going to do. Wash your hands and put on gloves before you do it. Then after measuring the temperature, remove it, take the probe off. I know that's not in here. Those covers are often called probe covers. Um, and then read it. Now you could clean and rinse the thermometers depending on um, you'll have to find out from your agency how to clean it. But if they're the little thermometers, sometimes they'll take an alcohol swab and just clean it with, or a Lysol wipe. However, if they have the covers on them, sometimes we don't even clean them. Okay. Always wear gloves because you're by the mouth. You don't have to wear it if you're going underneath the arm, or one on the forehead where you're not going to touch. Okay. The next is the rectal temperature, and this rectal temperature is, you should only use one for rectum if it says rectal, and they're usually in red. And by the way, anything that's in red should make you say stop and think, right? Because they'll put caps on medicine, like and if it's red, then that means that maybe they can't go in the eye, even though it looks like an eye drop. And in this case, red is for rectal. So if it's a red, it has to be a red probe and saying rectal use only. So here again, I'm going to tell you, you will eventually have to memorize these, but you could look these up. So here's forehead temperatures, what it would be, ear temperatures, but always call the agency. When in doubt, unless it's exactly 98.6, no, always call them. So just so you know, the forehead temperature, look at the range here from 96.4 to 99.7, and these are all taken in Fahrenheit, usually in our country. Um, in the hospitals, they do them in Celsius, but for at home and for the assisted living, it'll be in Fahrenheit. And then oral temperatures, right? 96.8 to 99.3, a big range, but you could see the rectal temperature is a little hotter, and so is the ear temperature, can be hotter if it's in far enough. Um, okay, we went through that. So I'm going to show you I was going to show you how to read a glass thermometer, but no one should have glass thermometers now. However, um, because they have mercury in them, so they shouldn't be using the glass thermometers with mercury. For CNA class, sometimes we have to teach that, but you'll be using the automatic ones. Okay. So again, when we're taking the oral temperatures, we could hold the thermometer at the end, clean the probe with an alcohol swab, but we do want to put a disposable cover over the probe. Now, if you're in someone's home and they're only using their own, that may not be the case. But so a way to clean that is when they're done is to take an alcohol swab. You should be wearing disposable gloves. So again, leave the thermometer in place until most of the automatic ones, the little ones, they'll beep, and they could take up to a minute, some are quicker, and then take that and eject the disposable cover, and sometimes you have to take it off. However, you should be wearing gloves, and then you could just throw that in the garbage. Some hints about doing a rectal is that the patient should be in a side-lying position with their knees flexed, should have lubricant to put on, and put in about 1 inch. For this class, you're not going to have to do that, but those that are going on to CNA, I'll just explain it how to do it. Okay, and then with the ones that go in the ear, what I have found is sometimes people do not go in the ear canal far enough. So always ask the person, is this uncomfortable? But I've found that people often don't put it in, and they're not asking if it hurts, and they could stick it in a little bit further. I don't think I didn't say tympanic temperature is an ear temperature, because it's getting close to the tympanic membrane inside your ear. That's your eardrum. So they call it tympanic temperature. So elevated temperatures would be abnormal, anything that's not in the normal. And if they're elevated or high, the is usually caused by infection. Okay. However, um, pain could cause it to go up a little higher. You're like stressing your body out, it's working harder. Dehydration, warm surroundings. And if it's hot and we're covering people up with blankets, it's not a good thing. And then drinking hot fluid. So if they're drinking a hot fluid, and then if you're taking an oral temperature, you're supposed to wait at least 20 minutes before you take that temperature. Otherwise, it's not accurate. They just drank some hot coffee or hot tea or hot soup. What could cause temperatures to go down? So if they're losing blood, if they're in a shocky condition, such as they had a allergic reaction to something, if they have areas of their bodies that are burned or skin is gone, and that helps retain temperature, so that could cause a lower temperature. And again, if they're cold, if they're getting hypothermic, and people always think, oh, in the ice cold, but here in San Diego, we have people living on the street, and when it's 32 and 34, they could get hypothermic, and then drinking cold fluids. Okay, so measuring the pulse. This is what I think is important for you too. We usually measure the pulse, the radial pulse, which is here on the wrist. So what you're actually feeling is every time the heart contracts, it pushes blood through those arteries. And it's kind of like a ripple effect, like you would see on a cartoon. And every time that blood goes through, you could feel it ripple through the artery. Okay, so we're actually counting how fast the heart is beating. That's what we're doing, the rate. So a lot of times we call the pulse heart rate. And the average for adults is 60 to 100. So that's a big range, right? Um, as people get older, they often get irregular pulses, so it's not a boom. You're not feeling a boom, a boom, a boom. You might be feeling ba boom, 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 ba boom. And so as long as their rate is between 60 and 100, that's usually okay, although you should be observing for that because if it's a new condition, they try to treat it because it's better to have a regular heart rate than irregular, not regular. But mostly we're looking at the rhythm, or I'm sorry, the rate, how fast, the number of beats per minute. So everything is uh, measured over a minute. The rhythm is how regular it is. Is it regular? Boom, 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 or boom. Irregular. Boom, 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 boom. The strength and force, really, because you'll be new, and even for someone older, like who's been doing it a long time, it's hard to figure that out, um, how strong it is. But the rate and the rhythm, we should be able to do. So, for this class, because I'm not in person with you, I'm going to make sure you know where to feel for the pulse, and I want you to be able to do a radial pulse. Um, and so this is I'm going to check the placement for a carotid pulse. So the 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 radial pulse is measured. It's and I'll make a video for this of where, and I'm going to have you send me a picture or I'm going to do it online where I could see it real close. But it's right down the thumb. There's usually a bone. There should be a bone sticking out here. Oh, that's the radius bone. And the artery lays right next to it. And so look in the skills and I'm gonna make sure you know how to feel that and then count it over a minute. Um, but I want to make sure you have good placement. Then the carotid pulse is where we feel when we're going to see if someone needs CPR. It's in the neck. And this one is right on the side of go to the Adam's apple, go a little bit over, and you should be able to feel it. Okay, so those two. The femoral pulse is in the, let's see, is in the well, I was going to say the femoral area, but in the groin area, and that's a nice strong pulse too. An apical pulse is when we listen with a stethoscope over the heart and we count what we hear. For this class, we're not going to do that. Um, okay, so if you go back and watch this, this explains the radial, carotid, and apical, and it's also in your book. And this is where, when we listen with a stethoscope, as they're doing here on the chest, the apex of the heart is down here, and that's where it gets its name. And so but it's kind of where we do the Pledge of Allegiance. Okay, so you're feeling your hand over your heart. That's where you would put the stethoscope to hear ba boom, ba boom, ba boom. Okay. So pulses, there's many other places. You could feel a temporal pulse, a brachial pulse is in the inside the elbow. The femoral, I showed you, there's a pulse behind the knee called the popliteal, and there's a pedal pulse on the top of your foot. If you're planning to go on to school for any kind of healthcare, pulses are important. So it's good to get to feel your body, and if you have family members, kids, start feeling these pulses. Look for them. Radial, brachial. Get used to feeling other people's anatomy as well as your own. Try to find all these pulses. The one behind the knee is very hard to find, and the one on top of the foot may be hard to find, but the femoral, brachial, you should be able to find. Okay, so a pulse is what we feel, boom, over a minute. So what you're supposed to do is locate the pulse. So we locate it in the arm and in the wrist. I'm going to do a radial. And then for a full minute, we're going to count how fast that beat is going. It's easier with an old-fashioned analog watch, which is the ones that have the second hand. And so I'm going to have, where there are the CNA films of how to do it over a minute. And so I want you to watch that. And I'll set up some quiz questions with that. Okay, and then the other one is counting respiration. So that's one you don't need any equipment for. So every time someone breathes, their chest is going to rise. And sometimes it's not really seen as much in the chest as it is in the belly because your diaphragm, your muscle is down here, the diaphragm muscle. And when it goes up, and then goes down, that's what helps. That's the main muscle that helps the lungs to breathe. So every time, there's two parts to one respiration. Inhale, exhale, that's one. Inhale, exhale, that's two. So that one we're going to do live. You're going to do it on me one by one, and you're going to count my breathing. Now, I try to get a side view of um, of people when they're breathing, so we could see it from the side. It's just a little easier. Okay, the average respiratory rate is 12 to 24. When someone's sleeping, it's usually lower. If it's lower than 12, you definitely need to report it, because if you're taking care of someone who's on pain medicine, that could slow your breathing down. As we know, fentanyl is a pain medicine, and what happens? People stop breathing if they take too much, right? So they may have to change different kind of methods to decrease the pain. If they're going too fast, they're having some shortness of breath. It could indicate that they're getting a pneumonia um, or other problems. So we need to report that too. The last thing is looking at those respirations. So if they're too fast or too slow, those are the main things. But if they're noisy, like uh, uh, that could be because there's fluid in the chest or too much mucus in the chest. if they're saying they're short of breath. And if we're not breathing well enough, we're going to get what we call labored breathing. So they're really working at they're really working at it. So it's labor. They're in a lot. It's labored breathing or shortness of breath. And if they're not oxygenating well, they may get cyanosis. Okay, so it's a blue color, and we've probably seen that with kids that are swimming in the ocean and they get cold, or in a pool and it's getting cold out and they get a little bluish around the lips. And that has nothing to do with short of breathness for them, but it has to do with they're keeping all that nice warm blood internally, so they get a little blue around there. So the blood pressure has two numbers, a top number and a bottom number. The top number is systolic. You could think about that as stairs going up, systolic. It's the maximum pressure when the heart contracts. So when it contracts, that's the highest pressure. And normal range for adults is 120 or less. They like it to be 110 now. And then the diastolic is the down number, the one on the bottom, and they like that to be at 80 or less. And so what you're doing with a blood pressure, and this is the manual one, but it'll help explain when a blood pressure cuff is on your arm or wrist, what is it doing when it gets pumped up? It's a tourniquet. So it's not letting any blood through, right? And then as the way it works is as we release all the air out of this blood pressure cuff, because this one where I'm turning it, blowing it up, or if a machine's blown up, it's a tourniquet. So don't leave it on too long. It starts to hurt. And if we were doing it manually, which you're not going to do in this class, but you would be listening, and as we loosen up the cuff, and we let air out, the first time we hear a noise is when the blood is able to get through. So the tourniquet is loosening up, and when the blood can finally push through, that would be the systolic pressure. And then as we're listening, when the noise goes away, that's the diastolic. That's when the heart is at rest. So the other ones work they're the automatic ones are looking for the same thing. Okay, so one thing with the measuring blood pressures, um, let the person rest a little before you measure their blood pressure, right? If they just took a shower and were running around, because you may be using the automatic ones, and there's videos in this module about taking blood pressures, even the manual way, what you're listening for, so you know, and then how to use some of the wrist ones and the blood pressure ones from the arm that people could buy in the drugstore or Walmart. Okay, here's a chart that's really a little bit too hard to understand. All I would like you to remember is that the blood pressure can be as low as 90 over 40 to 100, a high of 150 over 84 is usually acceptable. But again, everyone's different. And if the blood pressure is usually 130 over 70 and all of a sudden it's 90 over 40, that's not a good thing. So always check and report. If you're supposed to be taking blood pressures, then report it. And another thing is you're going to be using the automatic ones. The patient looks okay, and you get some weird reading, change it if you could to the other arm, take it off, try to get a pulse, and retake it, because a lot of the automatic ones, even the better ones in the hospital, they get off where they're not working right. So if the person looks good, that's the most important. I'm not saying don't report it, but I'm saying, look at your patient. Okay, so there are some terms, and the term we're going to use for a higher blood pressure is hypertension, and that's the book value is if it's above 140 and above 90 on the bottom, either one if they're high. So you could have a blood pressure of 150 over 80, that's still high blood pressure, even though only one of the numbers is high. Or if you had a blood pressure of 130 over 92, that's still hypertension. Okay, and that's generally due to people having um, thickening and hardening of the arteries. First of all, your arteries are like elastic. Well, as elastic gets old, it doesn't stretch as well. But then if you have plaque from, and they say often from the foods we eat, that kind of corrode the inside and build up the arterial sclerosis, then your blood vessels, which usually stretch and open, cannot do that anymore. And hypotension is 89, below 90, so 89 or below. They say below 60, but for older adults, like I was saying, it could be down in the 50s, and I've had them as 40s, and they're fine. But if someone's blood pressure is low, they may experience more dizziness and faintness. So be aware of that and always report it. A lot of older people get low blood pressure because they're dehydrated. They just need more fluids in them. So give them fluids. Okay, and that you do need to watch the films because this is really something that you need to do. And it's easier if you watch the films that we have in the modules. Thank you. And here, so many numbers. How are you going to remember them all? But here's another set. Now, I think if you go by this set of reporting or this one, remember 90 over 40 to 150 over 84, or just Google it and report everything that you're not sure about.